Okay, good morning, everyone. I'm looking on the screen to see if people on the screen can see and hear.
They need to turn their cameras.
Great, thank you. Thanks, Nicole. Thanks, Lindsay, great. Good morning, everyone. My name is Elizabeth McIsaac. I'm the chair of the Housing Rights Advisory Committee. The clerk has confirmed that we have quorum, so I'd like to call meeting 9 of the Housing Rights Advisory Committee to order. Welcome, everyone. This meeting is being held with committee members and staff participating both by video conference and in person at City Hall in Committee Room 1. Members of the public may also attend in person or observe the meeting on YouTube. Because we are meeting in person today and remotely, I ask for your patience with any delays or technical issues. If you are registered to speak at today's meeting, please listen for me to call your name. I will call speakers in the order they appear on the list. The list of speakers can be viewed online by visiting the Housing Rights Advisory Committee at toronto.ca/council and clicking the speakers box for today's meeting. I request that staff and invited participants, as well as observers joining remotely, keep their video turned off unless they need to speak or answer questions. This will make it easier for me as chair to see the members as we debate and vote on agenda items. Members, for quorum purposes and participation in the meeting, it is important for you to keep your cameras on. I also ask that your microphones are muted unless you wish to speak to an item. And if members wish to speak to an item, please raise your hand. I will be looking at the screen to see you and unmute your microphone and indicate your intention to speak. When voting on an item or a motion, I ask members to raise your hand to indicate your vote. I also remind members that if you have any motions on any of the agenda items, that they must be submitted in writing and can be emailed to staff at hrac@toronto.ca. And although we may be meeting in different locations today, the Housing Rights Advisory Committee would like to acknowledge that the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And it is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. So to begin, may I have a motion to confirm the minutes from our meeting on November 19th, 2025? Thank you, Anne-Marie. All those in favor, can I see a show of hands, please? Terrific, thank you, carried. I also want to note that we have received communications that were just received just before 9:30 on items 2, 3, 4, 5, and 6. These were sent out, and so that's also additional information for the items as we get to them. Before we move on to the items and the agenda that you have before you, there is a new business item I need to bring to your attention. Addressing barriers to adequate housing for women, gender diverse people, and survivors of gender-based violence. I have the letter before me, here we go. A central topic of discussion and advocacy within our working group meetings and HRAC meetings more broadly has been about the administrative barriers placed on women, gender diverse people, and survivors of gender-based violence in accessing safe, culturally appropriate, and affordable housing. In alignment with these discussions, I wanted to share a position paper recently published by Nellies through the Toronto Women in Action Project, community-based work developed with their community partners, including the Native Women's Resource Centre of Toronto and the 519, called Breaking Barriers, Centering the Voices of Women and Gender Diverse People in Accessing the Affordable Housing System. Given that part of our mandate is to support the city's engagement with equity-deserving communities to help identify systemic barriers to housing, I am recommending that Nellies be invited to present the findings and recommendations of this report identified in the report at an upcoming HRAC meeting. Before I put forward the recommendation, I just want to open it if there's any questions or comments about this, or we can go straight to a recommendation. So I'm looking at the screen. Board says it's a good report. I agree. And I think it's important that we include this in our conversations. Seeing no other hands going up, I would then say the recommendation would be that the Housing Rights Advisory Committee request the Executive Director, Housing Secretariat, to invite Nellies to provide a presentation at a meeting of the Housing Rights Advisory Committee in the second quarter of 2026 to share key findings and recommendations from its recent paper, Breaking Barriers, Centering the Voices of Women and Gender Diverse People in Accessing the Affordable Housing System, with particular focus on opportunities to improve access to housing within the municipal context. With that recommendation, is that up on this? We're not putting it up.
We're just going to vote.
We're just going to vote.
To the agenda, and then we'll get to the item.
I thought we just did the item.
You introduced it to add it to the agenda.
Okay, so we will bring it back later.
Yeah.
Okay.
We just have to,
For information.
to vote in favor to add the item to the
Okay,
agenda.
so we need a vote to add the item to the agenda. Can I see all hands in favor of, I need a motion. Can someone please move this? Gord, thank you. All in favor? Hands are up. Thank you very much. Carried. When does it appear?
At the end.
Can we just do the item? Can we just do the item right now?
Suppose, yeah.
Okay, let's just do it right now. So I've read the recommendation. All in favor? Someone to move, so Gord moved it again. And all in favor? I see all the hand. I see Anne Marie's hand. Chase, do I see your hand? Yes, I do. Thank you very much. Carried. And done. Thank you. Great. Okay, so carrying on, that brings us to the my chair's update. I apologize, there's a lot of me talking for the moment. We'll change that shortly. So the next item, item 1, is my update. I'm pleased to share that our Supporting Unhoused Rights Holders Working Group and Improving Access to Housing Working Group have had the opportunity to convene and consult with staff on items related to their respective key priorities. As an update, the Maintaining Housing Working Group Chair, Annie Hodgins, will be providing her update at the next HRAC meeting, as the working group will be convening following today's meeting. I would like to highlight a few developments since our last meeting on November 19th, 2025, which impact the city's capacity to provide critical supports and services for people experiencing housing precarity and homelessness. In response to the proposed regulations under the province's Bill 6, first, I want to share that the province has recently released new and concerning regulations under Bill 6, the Restricting Public Consumption of Illegal Substances Act 2025. If passed, a TTC special constable would have certain policing powers, including the authority to arrest or charge people who are believed to be consuming a controlled substance in public transit. To be clear, this proposed regulation effectively criminalizes addiction and homelessness. It is contrary to the TTC's own Community Safety, Security and Wellbeing Plan, which requires TTC special constables not only to perform enforcement duties, but also to provide overdose prevention, community engagement, and mental health support services for people in transit. This approach begins with the individual person who is in distress and seeks to provide the appropriate supports and resources. As a committee concerned with the protection of people's right to housing and human rights more broadly, we strongly encourage City Council and the TTC to maintain this approach. Using the maximum available resources across all levels of government. Next, I want to share that in alignment with the motion moved through HS 8.2, which was our last meeting, I followed up and I wrote and submitted a letter on January 27th, 2025 to the Honourable Peter Bethlenfalvy, Minister of Finance, and the Honourable Rob Flack, Minister of Municipal Affairs and Housing, to express this committee's concerns regarding the cut to the Canada-Ontario Housing Benefit and the resulting impact for people experiencing homelessness. The letter highlighted that the COHB, has become the leading pathway out of homelessness, helping thousands of people experiencing homelessness to find rental housing, and noted that without additional funding, municipalities like the City of Toronto will have limited ability to support people moving from homelessness into permanent housing. To date, I have not received a response. At our last HRAC meeting, this committee submitted a letter to the City's Executive Committee, which included recommendations to increase supports for people in greatest housing need through the City's 2026 budget. The City has since passed its budget, and while I am pleased to see an increase in funding for the multi-unit rental acquisition program of $47 million over the next 10 years, There have been no increases to many of the programs and plans referenced in our letter, including the Winter Services Plan, the Rent Bank, and the Eviction Prevention in the Community program. There has been a moderate increase for legal services offered under the Toronto Tenant Support Program, but not nearly enough to meet the need. I recognize that the city is in a challenging fiscal environment, exacerbated by recent program cuts and systemic underfunding from the provincial and federal governments. At the same time, the Association of Municipalities of Ontario estimates that nearly 85,000 people experienced homelessness in Ontario in 2025. The city's limited financial ability to meet the current demand for adequate shelter space, rental subsidies, and eviction prevention supports contributes immensely to the city's homelessness crisis. While it is critical that other orders of government with the fiscal capacity invest in programs to meet the current need for people experiencing or at risk of homelessness, in order for the City of Toronto to meet its own obligations to progressively realize the right to adequate housing, it should consider doing a human rights analysis of its budget to ensure that the maximum available resources are in fact being directed to realizing the right to housing for everyone in this city. That is the conclusion of my update since our last meeting. I don't know if there are any comments or questions. Diana.
More of a comment. You mentioned obviously that the government, provincial government rather, is currently consulting on extending the provisions of Bill 6 onto public transit, including the TTC. I also want to flag that similarly, they are looking at new regulations for Bill 10. If we're not aware, Bill 10 essentially criminalizes drug use in any kind of rental or commercial spaces. So in this case, the landlords are targeted, which is an interesting policy approach. But the regulations that they're proposing now would exempt social housing providers, supportive housing providers, but still extend to private market housing as well as commercial businesses. So I want to flag that although these are welcome regulations, I still disagree with the content of the bill entirely because it will have effects on tenants and their ability to secure permanent housing. So just want the committee to be aware of this as well.
Thank you. Are there any other comments? I think that's an important contextual piece for us and very important for the city as we think about this, the options for people in housing and their security of tenure as tenants are, or as landlords are going to be empowered to do or responsible for things. Any other comments at this point? Then I would ask someone to move to receive this item. Thank you, Diana. All in favor? Everyone, thank you very much. Carried. The next item on our agenda is a progress update on the city's supportive housing evaluation. Matt Hilder was going to be here instead. We have Jen, last name. Jennifer St. Louis is going to be presenting from the housing secretary. I'm sorry, apologies. And I believe we also have a consultant from Blueprint to deliver a joint presentation on an independent evaluation of supportive housing programs operating at the city. Over to you.
Oops. Thanks. Let me just wait for the presentation to come up, and no worries. I'm a last minute fill-in, so you don't need to know everything. Thanks very much while I get this slideshow set up. Thanks very much for having us. I'm really excited to be here. My name is Jen St. Louis, and I am the Acting Director of Housing Stability Services with the Housing Secretariat. And I'm joined today by Molly Doan, who is our one of the evaluators, the lead evaluator working on the supportive housing evaluation from Blueprint. So I'm going to start. We're going to go through some of the HousingTO action plan related to supportive housing, give a bit of a background and the evaluation overview, and then I'll pass it off to Molly to talk about the preliminary findings, and then we'll open it up to discussion. So the HousingTO plan, Canada's, which we all know, Canada's first human rights-based housing plan was adopted by Council in December 2019. The HousingTO plan provides a blueprint for actions and investments across the full housing continuum over the next 10 years, and that includes investments and targets for the approval of 18,000 supportive homes by 2030, as well as other affordable housing protecting existing supply and eviction prevention measures. Supportive housing is a bit of a challenging term to get a handle on. We have quite a web of support services that are connected to housing that we call supportive housing. But supportive housing generally is affordable. In most cases, there is a rent geared to income subsidy layered in, so it's deeply affordable housing. And it's designed to provide access to a range of services based on the tenant's need that supports housing stability and supports residents to live independently and improve their housing stability, health, and well-being. Based on tenant choice and providing the same rights and obligations for tenants and landlords as other rental housing. So it's a question that comes up a lot. Supportive housing is housing. It is housing that is protected under the Residential Tenancies Act, and there are layered supports in addition to housing. In Toronto, we've prioritized the housing for individuals who are experiencing homelessness, particularly chronic homelessness. Supportive housing in Ontario is supported through a very complex system of federal, provincial, municipal, and non-governmental partners. There is actually, I'm not going to talk about that. I was going to go into my housing speak about the download and how the province actually kept a bunch of supportive housing. But it's a very complicated system to understand because of the complexity of funders and types of programs. The city has endeavored to build new supportive housing and along with nonprofit partners and government partners, we've pursued a number of strategies to quickly create new supportive housing. So this includes new modular construction on city-owned or city-controlled land. Also includes the acquisition and conversion of non-residential properties, so primarily motels and hotels that we've converted to supportive housing. We've also leveraged existing housing supplied and layered in support services. And funding the delivery of new supportive housing models by nonprofit and Indigenous partners. The new construction has been achieved by leveraging capital funding through key federal programs, and it's a variety of different programs. Our evaluation approach I'll talk about now. So to assess our progress and identify opportunities for continuous improvement, the Housing Secretariat procured an external evaluation consultant, Blueprint, to evaluate supportive housing programs administered by the city. This evaluation was directed by Council in 2023. The evaluation includes a variety of program types, including permanent supportive housing sites, such as the modular sites, as well as the Rapid Rehousing Initiative. Blueprint was selected through a competitive RFP process and brings experience working in housing, homelessness, and social services, alongside individuals from equity-deserving groups. The evaluation approach is rooted in the principles of housing as a human right, particularly when engaging with service providers, their staff, and the tenants of supportive housing. The evaluation and scope, the evaluation aims to assess the housing stability and tenant outcomes, including how well the programs actually prevent returns to homelessness. We wanted to examine the program design and implementation, including documenting key features and how they're experienced by providers and tenants. Additionally, we wanted to identify opportunities for system improvement, including collection of data, monitoring of outcomes, and recommendations for all orders of government. And the ultimate goal is contribute to our ongoing efforts and to learn from our experience in order to expand access to supportive housing in the future. We really focused on two distinct programs in the scope of the evaluation. So the first are permanent fixed site supportive housing. So when we were scoping this, we wanted to scope programs that were city-funded and administered. So that was kind of the overarching scope. And within that, we have permanent fixed-site supportive housing. And on the screen, you can see some of the features. So these are purpose-built, stable, long-term housing with on-site supports, either long-term or permanent. The support services typically are 24/7. Even if they're not on site, then they are available. And these are in new renovated buildings with a target population accessed through our PATH system of people experiencing chronic homelessness, needing additional support to live independently. The second program that was in scope is the Rapid Rehousing Initiative, which was developed to quickly move folks from shelters into TCH and TSHC, so Toronto Community Housing and Toronto Seniors Housing Corporation buildings, with follow-up supports. These are mobile support services. They're not always on site, and they're typically short-term, so they last 12 to 18 months or can be extended if the tenants require ongoing supports. These are scattered kind of within the TCH and TSHC portfolio. So Molly can talk about we treated them a bit differently in the evaluation. The evaluation draws on 4 lines of inquiry. So the evaluators reviewed administrative data and analyzed it, so assessing housing stability and other outcomes using our city-held data sets. We also completed tenant and housing provider engagement. So we examined program experience through 4 tenant focus groups with a total of 55 tenants participating. We had 6 provider focus groups, 3 in key informant interviews, and an online survey of 24 housing providers. The evaluators also reviewed documents, so city policies, program design, and funding structures, and as well completed a jurisdictional scan and evidence review to situate Toronto's outcomes within the broader research evidence and benchmark performance against comparable jurisdictions. So that's kind of the boring part, just a little overview of what we did, and now Molly's going to talk about all the exciting things we found.
Thank you, Jen, and thank you for inviting us here to speak today. As Jen said, we use a number of different data sources to understand at a high level what outcomes were being achieved and what was actually happening on the ground with the supportive housing system that's funded and administered by the City of Toronto. So, as Jen highlighted, we looked at administrative data that the city is capturing, so things like annual occupancy reports, SMIS data, to understand to what extent are the desired outcomes, like keeping people housed, or to what extent are those outcomes being achieved. We had direct engagement in person with tenants of supportive housing to really understand their experiences and what it feels like for them to live in supportive housing, what has been working well for them, and where are their challenges that they experience living in supportive housing. We also held in-person conversations with providers to understand what the work has been looking like for them. And we met with both frontline staff and with managers and supervisors. We, as Jen said, we worked with the Housing Secretariat to really understand the program model. What are the different services available? How are they offered? And then finally, as Jen highlighted, we looked at what are other jurisdictions doing and what might we learn from the way that supportive housing is being rolled out elsewhere? And how might we benchmark the outcomes the City of Toronto is achieving relative to other jurisdictions? So I'm going to dive into, as Jen said, some of the things that we're learning thus far, and this is just some of the things. But I first wanted to start by talking about housing stability. What we are seeing when we look at the administrative data, when we look at outcomes, is that a very high proportion of folks are staying housed in supportive housing. So within fixed site supportive housing, we are seeing that within 1 year, about 3.6% of folks return to shelter. And within 2 years, we're looking at a return to shelter rate of about 6.7%. That is actually lower for rapid rehousing. We're seeing about 1.5% of folks returning to shelter within the first year of tenancy and 3.2% within 2 years. When we look at these numbers, they do compare pretty favorably to other jurisdictions. So we Other jurisdictions measure housing stability outcomes in a myriad of different ways. There's a lot of nuance to it. But generally speaking, these are at the top end of the range that we see when it comes to return to shelters after 1 and 2 years. Yeah.
Next slide.
Yes. But it was also really important for us to not just look at is someone remaining housed, but how are they experiencing that housing? And what difference is it making for them? And this is where direct in-person conversations with tenants were really, really critical. So we had the opportunity to hear directly from folks around to what extent supportive housing, moving into housing, made a difference for them. And we looked at this across a number of different dimensions. The most common changes that we heard from folks were around overall comfort, happiness, and life satisfaction. And we really heard folks emphasize the level of pride they have in having a place to call home, a place that is theirs, a place where they have a key and they can come and go as they'd like. And that was really contrasted to their experience of, say, being in shelter and feeling like there wasn't nearly as much stability in their life. We heard really clearly that folks felt that there was greater choice and control over their daily life, over their routines. And again, this was especially in contrast to folks who had been in shelters or other temporary settings. And then finally, really important for supportive housing, we heard that there was a much greater ability to access support and help, knowing where to go. For a broad range of services, as Jen said, it's a fairly complex web of supports that are available as part of supportive housing. And we heard from folks that they were getting supports with things like managing appointments, medications, household responsibilities, connecting to health, primary health, mental health supports. Really importantly, there's a lot of nuance to the changes tenants experience. It really differed depending on where you live, depending on your life experiences, depending on the relationships that you had with building staff, with site staff. So it's really important for us to, as part of the evaluation, to document what some of those factors were that were impacting the extent to which tenants experience changes. Some of the big things we heard, and I reckon these won't come as any surprise, but we heard that the building environment, relationships with other folks in the building, interpersonal relationships were really key for tenants. We heard that the relationship and the trust that is built with an individual and their support worker or workers is really critical. And we heard, and I'll talk about this in a little more detail, that when it comes to experiencing changes in other areas of their life, like improvements in mental health, improvements in physical health, that really very dependent on whether or not they were able to get access to those types of supports, recognizing that there are some real constraints in the system when it comes to the availability of timely, culturally responsive mental health supports, for example. So overall, though, why don't we advance and I'll talk a little bit more about tenant perspectives. So we spoke with them about what, if anything, had changed in their lives. We also asked them how they felt about where they lived, what they liked, what they didn't like. Overall, generally speaking, most tenants had a positive view of their housing. I want to caveat, though, that of course they raised some day-to-day issues. So that includes things like elevators being out of service or maintenance, wanting to make sure that the quality of housing is maintained over time. When it came to supports, most tenants that we spoke with felt that the supports were aligning with their needs. But a really critical element that we heard was that the adequacy of supports often varied dependent on whether or not those supports were easily accessible on site. So how easy would it be for an individual to walk downstairs and speak with a caseworker, get access with a particular type of support like mental health supports? And we heard from folks that had those supports available on site that they had really positive feedback. And I wanted to highlight some quotes directly from folks that we spoke with. So that's what you're seeing on the right side of the slide. As I mentioned earlier, tenants really stressed to us how critical it was that they had strong relationships with provider staff, with support workers. We heard some really great stories of what that looked like for folks to build that relationship. And we also heard of some challenges, particularly when there's turnover in support staff. We heard this also from providers, that there's a fair amount of workforce strain given the challenges associated with doing this work. And then finally, as I noted, tenants also shared with us that they are finding that some supports are just more difficult to access. These are things that folks around the table, I think, are quite aware of, but that includes treatment supports, supports related to substance use, mental health supports, and that really can be tied back to the barriers or challenges and availability we're seeing at a systems level for those types of supports. From the provider perspective, so we had the opportunity to speak in person with almost every provider in scope for the evaluation. And what we heard and what we saw was that providers bring a lot of experience, a lot of expertise in delivering supportive housing, but they also face a lot of challenges at a systems level within their, one of the things that we heard really clearly was that the needs of tenants change over time. And someone may come in requiring a certain type of supports, and there may be a crisis in their life. Alternatively, they may stabilize. And we heard from providers how important it is that the system be flexible as needs of tenants change. So an example of that we commonly heard is folks aging in supportive housing. How do we make sure that there are bridges for those individuals into things like long-term care when the supportive housing system is no longer set up to fully meet the needs of that particular individual? We also heard, and Jen touched on this, that supportive housing really works within and experiences challenges related to all the other publicly funded systems that interact with supportive housing. So that includes your primary care system, mental health care, substance use, long-term care. And providers did emphasize that there are capacity limits, there are wait lists, there are barriers, and this has an impact on the folks that they're working with and is really keenly felt. In particular, and again, no surprise, the gaps that they raised were around physical and mental health care, substance use and recovery, what was raised earlier in this meeting around regulations, prevailing attitudes towards substance use in the province, and also related to services for folks with physical and intellectual disabilities. Okay. So I think that's just a few things that we're learning with more to come. I believe we did want to open the floor to questions, and we wanted to bring to the table a few things that we would love to hear from you all in terms of things that it's most important for the evaluation team to consider as we prepare the report, as we prepare recommendations, and also one of the things that Jen mentioned is part of the evaluation, recognizing that this is the first external evaluation of supportive housing since the city took on a leadership role. One of the things we are focusing on is how can we invest in more research, more evaluation, more data gathering, and in particular, what information, what data would help HRAC achieve and pursue its mandate as a committee. So I'm going to pause there.
Thank you very much. That was a great overview and some really important research to help us understand how we can do better and do more of what works. We do have one speaker to the item, so I would like to, is Miguel in the room or is he online? He's online. So we have Miguel Avila Velarde, who is a TCHC tenant. Miguel, are you available? There I see you. The floor is yours. You have 3 minutes. 5 minutes, sorry, you have 5 minutes.
Oh, thank you. All right, so I want to emphasize on the evaluations of this report, the overview. There is one item that is not reported in this review, is the absence of consultation with TCSC tenants when they roll up this rehoming housing strategy. I have lived in this building, 220 Oak Street, for 16 years. The last 13 years, I was able to sleep every night and be available to work, go to school, and pay my rent on time. But since new residents have moved in due to the high rate of turnover in this building, people die of natural reasons, sometimes suicide, and drug overdose. So we have a lot of empty space around here. And they're being filled in with residents that come from the shelters and encampments, which is good that we're addressing the crisis of housing. But not, it should not be at the back of the residents who have lived for 16 years in this community without the interruption of being awake at night by noises, specifically with residents who have, as report indicated, that the supports are only available for a short time, and maybe they can be extended. And it's a complicated matter. And substance abuse, they don't know how to deal with it. And in fact, the problem is most of these residents are awake during the night. And I am a person who is used to the routine of going to the gym, going swimming days off and on, and go to City Hall. Today, I wish I was there in person to deliver my deputation so that the Housing Secretariat can listen to me and not just the voices of those who are in silence. I have a 35 signature petition to the landlord to deal with the noises that we are experiencing because we are 40% of this community are people over the age of 59 years old. So we are aging in place. We desperately need to find solutions. So I came up with one solution. I test my unit for vibrations and noises with the help of friends from No More Noise Toronto and the City 311 service. So finally, I was able to validate my complaints to the landlord, to CSU, that I'm hearing noises that are very high decibels, up to 89 decibels some nights. My friends, how can you sleep at night with such a high level of decibels? So I was able to convince management of TCAC, the landlord, and hopefully the Housing Secretariat and the Toronto Homeless Housing and Support Services can provide the funds. I'm proposing soundproofing of residential units. That will drastically reduce the noises up to 89%. And the reason is because you have a mandate. TCAC always says to me, Miguel, we have a mandate to house anybody. Fantastic, do it, but not at the cost of my health, my physical health damage. I have lost hearing in both ears. So I want the city to understand there was no consultations with Toronto or residents living in TCAC, number one. That is the biggest failure of this report review. Secondly, we have to have solutions in place. We cannot just continue on and on calling the CSU, Community Safety Unit, or the Toronto Community Housing, or the Toronto Police, or 311. That's nonsense. It's not going to fix the problem because it will be hard for you to relocate a tenant. By the way, I support the new building, the new constructions of modular units. Perhaps this will be a place for residents who are hard to house or have difficult times sleeping at night. I don't know. I have asked for relocation. I have asked for transfer. So I have experienced the lowdown of this rehoming housing strategy. And I just want to make you be aware of that the old residents living in this community deserve respect, deserve to be acknowledged, deserve to be considered. You need to be sensible where you place those new residents coming from the shelters and encampments. Thank you so much. Have a great day.
Thank you very much, Miguel. I now want to turn it to members of the committee. If anyone has comments, questions for the presenters. Diana, go ahead.
A lot to unpack here. First, Blueprint does great work. You did work for us in Peel Region regarding the funding shortfall, so I'm very familiar with the work that you do. Excellent work. To what Miguel was speaking about, You know, I've worked frontline for quite a long time, and what we hear a lot from tenants is that because of the mix of people in the building, there can be disruptions that do actually cause health and safety concerns, and what that can sometimes lead to are evictions from what technically should be supportive housing. And so while I recognize that you're showing us the numbers of people who are returning back into shelters in the street, that it's relatively low compared to other jurisdictions, it is still an occurrence.
It is. It absolutely is.
And I would like to know, as much as possible, again, it's hard to track and follow where people may actually end up, what some of those reasons are, especially if they are related to disruptions, to evictions. That's really important for us to understand to try and mitigate as well. So I really appreciate the deputation, and I think it's really important that we look at the reasons why people are exiting back out onto the street.
Absolutely. I can, Jen, I'm happy to speak to that.
Sure. You can speak to the research and.
Yes. So we had one of the things we discussed with providers was when evictions do happen, why? What is going on within the building? What is leading to this? What we heard is that evictions are treated with a great deal of gravity. It is a big deal. Folks, the providers described it as very traumatic for the individual and also traumatic for staff. What they described is that there is a small segment of clients who may be experiencing crisis and may be showing up with behaviors that that are perceived to jeopardize the safety of other residents and sometimes staff. We heard that this is a small segment of folks where there is highly disruptive behavior. And those are the cases where we heard that evictions are happening, where there are some real concerns around the safety of staff, the safety of other tenants, where there are perceived to be fairly big disturbances in the building and it's affecting the community, broadly speaking. We heard that this is a long process. We heard that steps are taken to try to resolve this, but also that sometimes the supports that someone may need, particularly, for example, if they're in mental health crisis, that those supports may not be available in a way that could help stabilize that tenancy. This is also, like, one of the things we did is look at the literature, and there's some recent research that was done in Toronto, in Canada, on why evictions are happening. That was work led by Vicky Sturgopoulos, I believe. And they found the same thing, that it is a small proportion of tenancies where you're experiencing more disruptive behavior that has an outsized impact on other folks and on staff. And those are the cases where we're seeing more evictions. So that's what we're seeing in the research.
Yeah. And I can just speak to, I mean, one of the exciting parts of the research, I think, is the note that sometimes the support and the need is mismatched. And that can happen at assessment. That can happen because needs change over time and they're different. And I think coming out of this research, we need to look at how to be responsive to that in a way that doesn't potentially end in eviction. So I think that's a really exciting part of this research.
You have a follow-on?
More of a comment, but you can ask a question.
It's actually Lindsay has her hand up, so I'll turn to Lindsay and then I can come back to you. Lindsay, go ahead.
Okay, thank you. Bear with me. I'm very nervous and I'm a survivor, so a lot of the things come up. But I really appreciated that presentation, and it's kind of in alignment to a couple, well, basically two strategies that have been implemented in Canada so far that I think would help in terms of recommendations. So these are just two ideas. There's two places within the supportive housing structure, even utilizing the modular buildings. One's called Derry's Place, and that's in BC, and the other one is called the other one is actually in Sault Ste. Marie, and these essentially are a stage 2 strategy. So whether it be shelters or homelessness, instead of going right into kind of the supported housing where their needs may not be fully met, it's called stage 2 housing. So these two places have been implemented so far in Canada. And these supportive housing, the one in Sault Ste. Marie I'll touch on first because it's a little bit broader. These supportive units are part of two separate projects aimed at addressing urgent urgent housing needs in the community. So essentially, they'll provide supports within the 22. Essentially, it's a bridge from the shelter unit into a stage 2 housing that has all the supports on site. It's designed for two kind of vulnerable populations, one being women and children fleeing abuse, and the other would be those with addictions and mental health crisis or issues. And again, it has the sites provided on-site, on-site healthcare clinic, on-site mental health and addictions. And then for women in crisis, they have, in-demand skills training and stability services. And this is provided up to 2 years. And the caseworkers within those residents can advocate for longer if needed. But it's kind of a stepping stone to make sure that they are ready. And I really think this would be helpful in, not regressing back into the shelter, because they really do have the supports. And again, one's called Derry's Place in British Columbia. And the other one, I don't know if I have the actual name of them, but it is in Sault Ste. Marie. And again, they also align with other not-for-profit agencies as well. So they work kind of in tandem. And I also want to preface that it probably would need funding, not just on the municipal level, but the provincial level. And I think that stage 2 housing could really, mitigate some of these things that we're seeing. I think it could really be helpful. And it seems to be in alignment with what you were also presenting on today. So thank you for hearing me out on that.
Thank you, Lindsay. Did you want to respond to that?
Lindsay, I really appreciate you sharing that. Thank you. And one of the things we did hear from providers is interest in things like bridging models. So that came out of our focus groups. One of the things they were interested in exploring was how can we create the conditions and think intentionally, strategically around setting someone up to really succeed once they get to supportive housing. So, and keeping in mind, this follows housing first principles, right? So we have to be mindful of that. But one thing we did hear is that there can be cases where, from the perspective of providers, where transitional housing, where someone has an opportunity to stabilize, to build some life skills, to build that bridge from shelters into housing, that from the perspective of providers, they see that as being quite valuable. So I appreciate you sharing that, and I've written down the names of the sites you mentioned, and we'll note that was something that providers raised as well.
Thank you. Gord, you have a question?
Yeah, I got a few. First, in your presentation, you say we compare favorably to some other jurisdictions. Could you tell me more about that? There's not much.
I definitely can. So we will build this out more as we put together a report, but one of the things we did was look at what are some of the benchmarks for returns to shelters, returns to homelessness, both sheltered and unsheltered, for unit turnover in other jurisdictions. So some of the jurisdictions we looked at that had publicly available data that was relatively comparable, recognizing that really every jurisdiction has a slightly different approach to reporting out on housing stability outcomes. So we looked at several jurisdictions in Australia, several jurisdictions in the US, like LA and Seattle. We looked actually, one that had quite good publicly available data was Aberdeen in Scotland, I believe. And what we were seeing for returns to homelessness, we were seeing about, after 2 years, in 2 locations that had a comparable metric, the return to homelessness was in the 20 to 15% range. What we are seeing in Toronto is closer to the 7% range for fixed site supportive housing. There are some caveats around there, just some nuance in how things are measured, but we are seeing really at the top of the range when it comes to some of the available benchmarks. And that will be elaborated on in the report that we put forward.
So just to make sure I heard that,
Yeah.
With all the caveats about the data sets, and I know that there are going to be a lot, Toronto's number is much, much better than
Yes.
any comparable you could find.
That's right.
Okay. The next question I have, so I was actually surprised to see that folks in rapid rehousing are better at staying than folks in places that are designed as supportive. Is that because there are different needs? Is that because, I just found it surprising.
Yeah, same. It is, and that is, you've got that right. I think typically they are lower acuity needs in the tenants that are at those scattered sites. And, you know, as we heard from Miguel's experience, you know, we do want to be careful about balancing, obviously, the, you know, incoming tenants' right to housing with the enjoyment of the facility of the other tenants. So the tenants typically have much lower support needs.
Did you look at all, so the data you've got here shows the bad outcomes, right? People returning to homelessness or shelter. Did any of your work look at people who are graduating out of not needing as many supports, or you're nodding?
That is such a good question and something we've been discussing and thinking about as an evaluation team. So with the administrative data that we currently have access to, it is really difficult to distinguish between, like, this isn't the right wording exactly, but a positive exit. So someone's able to move on to more independent housing versus someone leaving for other reasons. That is a key need and gap, and one in terms of putting forward recommendations. One of the things will be is we need to understand when someone leaves supportive housing, when they turn over, why? Because it absolutely could be that they move on to more independent living, and that's something we want to know. And there are supports in place. I believe HESH is in place to support with those transitions out of supportive housing. Right. So that is an important area, something we're not able to distinguish in the administrative data, but also something that has been highlighted as like when it comes to recommendations. We need to understand what's happening in terms of positive exits, and we need to be tracking that, and then we need to think about what services, supports, programs are in place to support that for those individuals who are able to stabilize within supportive housing.
Right. Now, to make it even more complicated, one of the things that I'm becoming increasingly aware of, as we're finally building more supportive housing, is, you know, as Jen said, it's a whole bunch of different things. And a thing I'm trying to think through is we used to talk about, in the homes for the aged space, a campus of care. And I'm wondering if anything in your research or knowledge talks about having a variety of supports for people with a variety of needs, either co-located or located close, or administered in a way so that, you know, maybe I had one set of needs before, now maybe I'm older and I have a different set of needs. Did any of your work touch on any of that?
So I can get started. So yes, there are some models that we looked at that were in scope for the evaluation that do have more integration of a variety of sports within their location. And in speaking with tenants, we received fairly positive feedback on those sites that have more integrated and embedded into the physical location. I wouldn't necessarily, and I would refer to Jen and other folks, wouldn't necessarily refer to them as like a hub model, but there's greater integration of supports within the supportive housing building. So we did hear positive feedback about that. One of the other things that really came up in our evaluation, and I know is something that the Housing Secretariat and City has been thinking about, is those models can make a massive difference, but they're also more cost intensive. So one of the key things to think about is how do we get the right folks to the right supports at the right time and do so in a way that is cost effective, really? Like, how do we maximize the amount of folks? How do we make sure that as many people as possible are housed? given the funding available? And how do we essentially right-size the supports that are available? Because that co-location, that integration can make a tremendous difference for folks that need that level of supports, but it may not be the solution that's required for everyone. As Jen said, there's thought that goes into like, where does it make sense for someone with a lower level of needs? Where does it make sense to house them? And might it make sense to have supports that are mobile, that come to them, that are less frequent? So that is a big area of focus for us in the evaluation, and I certainly know something that it's been something that the city has thought about.
For sure, and I think the flexibility of like service and supports throughout someone's kind of life is really important to think about as well. Getting back to the HESH priority, just to be clear of what that is, that's the households exiting supportive housing. And overall in the system, we had about 60, I think, in 2025, people who exited supportive housing, therefore leaving a space in that supportive housing, and they got RGI housing in the greater system. So I think that's something we need to work on to, it's a fairly new priority, and it's a new system piece. So I think we need to reach out to tenants and to supportive housing providers to, ensure that they know that this avenue is available.
Diana, did you have another comment you wanted to speak earlier? I just wanted to see if that's still. Okay. Okay. All right, then I'm going to just ask a couple of questions of clarification. So the comments from people really spoke highly about the ability to connect when possible with the right supports. And I think it was something about 40 or 50 people that were in the focus groups. Was that, are you able to disaggregate the experiences between those within TCH and those in dedicated supportive housing programs? Because those might be sort of colored a bit.
Yes. So we had much greater engagement from folks in the fixed site permanent supportive housing than from RH. So that is a very fair point and a caveat that needs to be emphasized in the report, that there was more engagement. You're absolutely right, from folks in the fixed site versus RH.
Okay. Because that skews a little bit of what we know.
Yes.
Doesn't necessarily skew that, but I think just clarifying that that's the story from that line.
Yes.
I have another question, which is we do have people that are exiting, and so to Diana's point, it's still important that people were evicted. Do we have any way of tracking what happened? Were they evicted to homelessness? Were they evicted to shelter? Do we have any way of tracking them, or are they just sort of lost in the data?
That is a very good question. So while that information is not available in the administrative data that the city necessarily has, what we heard from providers is that most of them are tracking. Was this as an exit to homelessness? Was this an exit for another reason? So that is information they have. And one of the recommendations and areas of priority within the evaluation is to think about how can we make sure that that data that we know providers are tracking, how do we make sure that that's shared in a consistent, clear way with the city so that they also have sight lines to what are those reasons why where does someone land when an eviction happens, and how can we then use that information to think about what supports are needed, what could have been done to mitigate that eviction. Yeah.
So from the point of view of the human right to housing, I would say that collecting that data, analyzing it and acting on it is absolutely essential as an outcome of this research.
Yep.
Okay. Yes, Lindsay.
Thank you. Just kind of going on what Gord was touching on, the housing stability. So I guess the return to shelter or homelessness stats. So the fixed site supportive housing, and I guess the rapid rehousing would be kind of Toronto community housing, for example. Are they under the same legislation with the Landlord Tenant Act in terms of evicting or leaving? Like, but here's kind of what I'm getting at. I know for Toronto community housing, not only is it very difficult to be evicted, it's also they're quite behind. So I'm just wondering if these are new stats. They may not be that accurate because the rapid rehousing individuals, it is much harder to get evicted in that. Or is this stat just focused on whether they leave or not? Or is it both evictions and leaving by choice?
The stat that we shared in particular is returns to shelter specifically, and we looked at the threshold was a minimum 5 days in shelter when we looked at the return
But
to
why?
shelter.
But why was it an eviction or was it a by choice or both?
It's a great question, and unfortunately, that's one of the gaps and one of the areas where we need to put a recommendation forward. We don't necessarily know that from the information. We know that there was return to shelter, but we don't have that critical information about why that's happening.
Yeah, because that's misleading in terms of that.
Yep, it is definitely missing.
I don't want to hinder the supportive housing model because I think there's a lot of value in it.
Yep.
Okay, I just wanted that clarity.
Yeah, and just to answer the question, all of the tenants, whether they're in supportive housing or at TCHC, do fall under the Residential Tenancies Act. So the eviction process would be the same through the Landlord-Tenant Board.
Okay. Are there any other questions? I'm looking to B.
I just wonder, maybe would it be possible to look at do some research on the behavior of these homeless people and get housing in either the supported housing or outdoor housing. And like what Miguel said, right? These people like their behavior, like making noises, things like that. Because I see people who are calling on homeless on the street when they come to shelter. They do the same thing as they are on the street. They throw the garbage everywhere, just like on the street, you know. And it is the big difference for people who are not homeless on the street or calling homeless that have been on the street for long. You see the different people homeless on the street, like Connie, homeless on the street for long. When they had their meal, their food, after the food, they didn't tidy up. They didn't throw their whatever garbage in the garbage bin. They just leave it on the table. And some they drop on the floor, they didn't even pick it up. I'm wondering, like, maybe they're so used, on the street, that's how they do, right? They eat and they throw, but when it comes to shelter, they treat it like on the street, You can see the big difference for people who eat and then they throw their garbage in the whatever, the thing that they finish, utensil, whatever, in the garbage bin, but not those people who are on the street. Because I know some of the people that I'm staying now, I know some of the people that they are on the street. I know them, and so I see a big difference. So I'm not surprised if they leave from shelter to supported housing. They might behave the same. They might making the noise like right now, right here. They on the music so loud. When the shelter Wi-Fi was or down for 2 months, I hardly can do any meeting. And it's so ridiculous. They only like that they are the only person who listen to the music, and don't care about people surrounding them are talking, and that will affect their conversation. No, that kind of consideration. And so maybe because they're so used to it, it might take them to learn a new behavior or learn how to behave. Not like on the street, but in a building, something like that. And because they haven't learned, and that's why they still continue to make noises, maybe like, like whatever. Like I remember one guy on a drop-in, he got house, not supported housing, just ordinary house, a room in a house. He played guitar so loud in the middle of the night, and he got kicked out because he was so used to on the street, play guitar, right? So I don't know, I mean, it takes time for these people to change, but I don't know, maybe do some research, what kind of service that we can bring a change to help these people for adapt from, not adapt, changing from their behavior from living on the street, now living in a building, that kind of thing. I remember my neighbor just across my room. He got a supported housing now, and he was so sad he had to live here. I said, why? He said, well, I'm not so used to be housed. I say, well, it's better to be housed than to be in shelter. You just have to open up yourself. When you open yourself, you will have new friends. Just like when you come to shelter, you didn't know that many people that you know, and you make friends here. And when you live here, you open yourself, people will open up to you, then you make new friends. You will enjoy your apartment in that building. So I don't know, like some people can adjust easily and change their behavior because they know the rule. You cannot making that kind of noises during the night that affect people, disturb people. But but some, I don't know, it's just so used to it. So maybe I don't know whether they can do some research and focus that how can how can how can we help people, transition from homeless on the street or homeless in shelter or wherever, and move to a supporting housing or RGI housing, stable housing that they can maintain and not get kicked out again. I mean, most of them kick out, if you say most of them go back to shelter, I can't imagine they'd rather go to shelter and have that kind of same life instead of like bound by the rule and regulation of the building. Thank you.
Thank you. Thank you, B. Did you want to?
Oh, I was just going to say, I think I'd like the examples that you've given. I think it really kind of reiterates the need to match people with appropriate supports at the right level for them in the right place. So thank you.
Right. Joy. Joy, we lost you. Can you turn your camera on and unmute?
I don't want it to have my video on because there's a delay thing, and I'm talking at a different pace. So I just wanted to say I found this a very heartening report. I'm not surprised actually results. I mean, we've known for a long time the value of affordable housing, and support services. What really also reminded me of is that as someone who's been involved with supportive housing for, I don't know, 40 years or so, is how much things have shifted from the provincial role and now who was the lead on supportive housing, and now how much it's up to the city and they have jumped in and taken this work on. And the work that you're doing, I think, is of real value, not just to those housing providers that are city funded, but to provincially funded ones as well. They will have some of the same experiences and some of the same struggles. And so I'm hoping that there will be an opportunity for connection and building bridges with the supportive housing provincially funded sector. The other thing I just would like to say is that I found that the report that you gave just about, here's some facts, just really helpful, just really grounded and helpful. What it made me also think about, though, is the work of HousingTO, who has, identified elements affordability, accessibility, habitability, security of tenure, and so forth. And I'm hoping that you will look to that list as you're preparing new questions and new things to investigate. That's it for me.
Thank you, Joy. Did you want to respond to any of that?
Just wanted to echo thanks for that, Joy, and you know, double click on that note around just the complexity of the system, how much it changes, and the fact that one of the things we've reminded ourselves of within the evaluation is that the city is still, like, the leadership role they've taken on in supportive housing, it's still relatively new. It's going back 5 or 6 years now, and that leadership role was taken on during you know, following the onset of the COVID-19 pandemic. There's a lot that's happening in the period of time that we're looking at for supportive housing over the past 5-6 years. And yes, noting that there's lots of work, lots of amazing work that we drew on, we're inspired by, lots of incredible folks that were engaged, provided input throughout the evaluation. And there's a need to continue to do that, to join forces and really think about shared learnings across the supportive housing system, because it's not just municipal, it's like absolutely there's a huge provincial role that we have to be cognizant of. The one other note that came up, you mentioned the word connection, and it stood out to me in meeting with providers they really appreciated the opportunity they had to all come together in person to talk about what are they seeing, what are they experiencing, what's going on. That was something we didn't necessarily anticipate, but in doing focus groups and sitting down with providers from all across the city, they found it really helpful, really meaningful, and wanted to see more of that.
I don't see any other questions. I want to just echo sort of where you began with the question of how complex this issue is, and also congratulate you and the staff on doing this research, the quality of what's coming out. This helps us understand what we need to do more of, and getting into that, the in-between parts of what we don't know, what we're not able to know, and how do we backfill that so that we can make it even better than it is right now. And I think also critical is taking these learnings and the need to the provincial level, ensuring that we have the right resources to actually resource the kinds of programs that we can see do work. So thank you for that. Thank you for everyone's questions. And with that, I will move to receive this item and look for all in favor. Hands up if you're in favor. Thank you. Anne Marie, thank you. And carried. Thank you very much. It's 11:15. I'm going to suggest a 5-minute break, and we'll come back to the next item. Thank you. I'm waiting for people to turn their screens on so we can have quorum and we can get started. One, two, three, four, five, six, seven. Yes? Okay, we are good to go. We're going to get started. Our next item, 9.3, updates to the RentSafeTO Apartment Building Standards Program. Dana Martin, Policy Development Officer, and Mitch Thibault, Policy and Planning Advisor from Municipal Licensing and Standards, are here to discuss elements of the RentSafeTO program. And over to you. Thank you.
Thank you. Good morning. We're happy to be with you today. As the chair mentioned, I'm Mitch, and this is Dana. We're going to provide a few updates on the RentSafeTO program as we're bringing a report to the April Planning and Housing Committee. I'll also just note that the district manager, the acting district manager of the RentSafe program, Anastasia, is over here. Give a wave. And we also have Alana Ruiz, who's the stakeholder engagement lead for the program. So we're happy to take any questions after the presentation or after the meeting. If you want to catch us in the hallway, we're happy to have a chat about the program or any other MLS-related program. So Dana's going to go through the presentation. She's been leading this work, and as I mentioned, we're happy to take any questions afterwards.
Great, thank you so much. Good morning, everyone. So the purpose of this presentation, we're hoping to gather feedback on the RentSafeTO program and some of the updates that we'll be including in a report going to PHC in April. So including a number of things, we're going to be gathering feedback on the program's evaluation tool and their category weightings, the audit threshold, targeted engagement, the implementation of the upcoming color-coded signage system, and remedial action as well. We've been consulting with stakeholders, with tenants, building owners, TCHC, and other social housing providers, and I've had a survey open since January, so these will all be informing the report coming to committee in April of this year. So I'll go over council direction, give a little bit of program overview, and then I'll touch on the kind of three major program updates, which are the building evaluation process, color-coded signage, and remedial action, and then go over some next steps. So for council direction in April 2024, staff were directed to report back on updates to the building evaluation tool, remedial action processes, and a number of other updates as well. And then in October of last year, City Council adopted bylaw amendments to implement the upcoming color-coded signage system. And as of June of this year, building owners will be required to, number one, post the color-coded sign near the entrance of their building. Number two, replace signage within 14 days of receiving notice if they happen to change colors, and then to inform tenants of the building's assigned color. This will be at request when they sign the lease, before signing a lease. So just to give a little bit of an overview on the RentSafeTO program, it's a bylaw enforcement program that was started in 2017, and it outlines maintenance and operational standards that building owners and operators need to meet and maintain. And it applies to purpose-built apartment buildings that have 3 or more stories and 10 or more units. So this is around 3,600 buildings across the City of Toronto, and it applies to around 326,000 units. The program also has a team of dedicated enforcement officers who conduct building evaluations, audits, and also respond to complaints and service requests. If there's a building that does not meet the outlined standards, there's enforcement actions that can be used, including issuing orders, notices, charges, and remedial action. And if you're curious about more information, we've just included the webpage link here. So I'll talk a little bit about the process for evaluations and audits. So every 2 years, each building undergoes an evaluation. So half are conducted in the first year and half are split up into the next year. During an evaluation, an officer will inspect the common areas of the building and assigns a score from 0 to 100% based on 50 categories. And each of these categories is rated between 1 and 3, and is also weighted by risk level. So we have some categories that fall under high risk, and this risk level is weighted at 3%. We have some categories in the moderate risk level weighted at 2%, and then a few in the cosmetic risk level weighted at 0.5%. Once all the evaluations are completed in a year, those building scores are converted into a percentile ranking to compare against other buildings. And then those that fall in the bottom 2.5 percentile will be selected for an audit the following spring. Audits included comprehensive inspection of common areas, so similar to an evaluation. However, audits also cover time spent issuing orders and notices, as well as tenant engagement. So staff will attend the building, set up a kiosk or information booth, talk to tenants, knock on doors, and really just spend time educating tenants about how to submit requests. And just for some numbers here, in 2024, we conducted a total of 47 audits, and in 2025, 55 building audits. And there's a fee that comes along with the audits, which is $3,000, and then an inspection fee on top of that, which is $158 per hour per officer. So now I'll talk a little bit about reactive score deductions. So once the building is assigned their initial evaluation score, that can be deducted if they have ongoing violations. So if a building has violations, that can be temporarily reduced by 1% if an order or notice is issued, and that applies for a minimum of 30 days. And then for every emergency order, so for things like vital services or low heat, that score can be reduced by 2% for a minimum of 4 months. And last year, we issued 2,050 orders at RentSafeTO buildings. As a result of those reactive score deductions, if a building score drops by 5% for at least 2 months, this will trigger targeted engagement where staff will attend the building, again, similar to an audit, set up an information booth, talk with tenants, go door knocking, and accept complaints for in-unit issues. And this comes with a fee of $3,000 as well. So before I jump into the program changes, these are some things that I want to highlight that we'd love your feedback on today. So number one being the changes that we are considering for the evaluation tool. So we're considering changing some of the weightings, the score deductions, and the targeted engagement threshold. Also the color-coded signage system. So looking for feedback on the thresholds for each color, the signage design, any challenges that you anticipate will come in June, and how we can best communicate these changes. And then lastly, considerations for the remedial action framework that we're developing. So we're curious in what situations and in how often we think remedial action should be used. Okay, so number one, the building evaluation process. So to go over a summary of kind of what we've been thinking about and considering, our goal for the evaluation category weightings is to place more emphasis on some of the higher risk issues. And this can be achieved by changing the weighting levels. So right now we are thinking about keeping the cosmetic percentage as it is at 0.5%, decreasing the moderate risk category from 2% to 1.5%, and then increasing the high risk level to 4.5% from what it is right now at 3%. And then also moving around some categories within those risk levels as well. For the reactive scoring piece, we want to consider larger score deductions to hopefully ensure that the building scores are more reflective of in-unit conditions. So we are thinking about increasing the 1% deduction for orders and notices up to 2%, and then increasing the emergency order deduction from 2% to 3%. And then a new idea to add compounding deductions, so adding further on top of those 2% and 3% deductions, an extra 0.25% for every month that an order remains open to hopefully ensure that issues are resolved in a more timely manner. Next, we are reviewing when targeted engagement should occur. So the 5% deduction after 2 months is the current trigger. So we just want to align this with any of the changes we're making to reactive scoring. And then also reviewing the timing of when evaluations and audits occur to ensure that they happen closer together. So right now, evaluations happen in the fall and audits happen in the following spring, which leaves a 4-month gap during the winter between the audits and evaluations. So we're thinking about flipping the timeline of this and having evaluations happen in the first half of the year and then allowing audits to happen swiftly after that in the fall to hopefully reduce the gap. Okay, on to color-coded signage. So we are considering a 3-color system based on the building's dynamic score, which includes the proactive and reactive score deductions, meaning that it can fluctuate, could fluctuate daily. We are proposing having the red category be assigned for buildings that score between 0 and 69%, and have this category or this sign be titled Needs Significant Improvement, meaning that the building meets few building maintenance standards and may have several violations. Buildings with a yellow sign would be those scoring between 70 and 84%, and this would read needs improvement, meaning that the building meets some maintenance standards and may have some violations. And then those that score 85 and up would get a green sign that reads satisfactory, meaning they meet most or all building maintenance standards and may have few or no violations. We ran some of the numbers based on our historical data from 2024 and 2025, and we predict that this system would result in around 2,700 green buildings, so 76% would be green, 748 yellow buildings, so 21%, and then 115 red buildings, or 3%. Here are some of the signs that we have drafted so far. So we have 3 signs, 3 colors, 3 different symbols for accessibility. So we're thinking about potentially a star for green, exclamation mark for red. And then on the sign itself, we would have information explaining what this color means, that it is reflective of the overall score, including any ongoing or active violations. A piece telling tenants to talk to landlords first, and if their issue cannot be resolved, then to call 311. And then a QR code and website link to prompt people to get more details about their building score if they would like. And I would say generally we've got some positive reviews on the sign design, but we're curious to hear your thoughts. Some additional details and considerations about the signage system. We want to make sure that reevaluations are able to be requested for building owners if they are not satisfied with their score and or color. So keeping that process open. Building scores and colors will be updated daily on the RentSafeTO web map. And we want to make sure signs are easy to understand using clear colors and symbols, make sure it's accessible and clear as possible, and people know what the signs and colors mean, so there's no misinterpretation. And I would say one of our bigger challenges is to not align as closely with the Dine Safe program, which assigns a similar red, green, yellow sign for restaurants. But with the red sign for Dine Safe, that means the restaurant is closed. So we want to be really careful in our messaging and our communications that we are clear that a red sign does not mean a building is closed. It doesn't mean that it's not safe to live in. It doesn't mean that it's uninhabitable. A red sign simply means that there may be several bylaw violations here. And that all buildings with a red category at the time the audit threshold is calculated means that building will be audited. So we just want to be clear about the meaning of red. Okay, on to our remedial action framework piece. So just to touch a little bit on what remedial action is and kind of how the city uses it. If there is a property owner that fails to address a violation, the city is able to hire a contractor to complete that repair work and then put the cost of that work on the owner's property tax bill. I want to highlight that remedial action is a last resort tool and is only considered in cases where compliance measures have not been affected or if there's an acute health and safety risk. And officers consider several factors before considering its use, such as the severity of the violation, if there's any risks to public safety, is it a repeat violation, is it a time-sensitive issue, and just generally the impact on tenants and neighboring units. So we are reviewing the use of remedial action and with the hopes of establishing a framework that would guide officers in more consistent use with a focus on protecting vulnerable tenants and resolving persistent noncompliance. So we hope that this framework will identify when is best to use remedial action and consider where it can improve the well-being of tenants. And we'll include an overview of this framework in the report that we will be bringing to Planning and Housing Committee in April. Just some additional considerations that I think are important to note for the use of remedial action. Number one, that we know it can be an effective way to address acute property standards issues and improve housing outcomes, particularly in cases when owners are absent, when there's persistent noncompliance, and when there are health and safety risks. Also noting that more complex issues would require a combination of ongoing enforcement, so issuing orders and charges, and could require conducting additional rounds of remedial action, but these would not be kind of the best case scenarios to use it. Alongside our priority response model and our ability to conduct audits, remedial action can be a helpful tool to advance the principles of the city's housing charter. And just a couple challenges, I guess, to note with the use of remedial action. City staff must be physically on site to oversee the work of the contractors, which would require a lot of time and resources and potentially pull away from other important work that our officers are doing, like conducting investigations, evaluations, and audits. If a repair requires access to multiple units, contractors need to provide advance notice to get permission to enter into the units, which could be a challenge. And repairs may uncover additional issues, which could require relocating tenants. So just some challenges to note. And then just some next steps. So we're gathering feedback still to inform the staff report intended to go to PHC in April. We're going to continue working with stakeholders to gather insights to inform these changes. And like I mentioned earlier, we have a survey open until the end of the month to hopefully get feedback from RentSafeTO building owners and tenants. So there is a QR code and a link here as well if you'd like to share that amongst groups. So that's all I have for now. This is just the same slide that I showed earlier, just kind of the things that we would love to hear feedback on as we continue to develop the report. So I will end there. Thank you so much.
Thank you very much. I'm going to open it to questions or comments from the committee. So Diana, you have your hand up.
I do. I have a lot. So apologies if I just occupy a lot of time here. We know that is, maybe it was 2024 that we changed RentSafe from having an absolute score threshold to actually being relative to the bottom 2.5% of buildings that will be audited. And I know that's not changing here. I just want to clarify, are we now proposing a hybrid model where there is that absolute threshold of red carded buildings, so to speak, being audited plus the 2.5 bottom percentile of yellow?
This is something we're still trying to work out the details of. So originally we were going to keep it at just the bottom 2.5 percentile, but we did want to have the threshold make sure that all audited buildings do fall into red. So we're trying to find a way to balance this. And one idea that we've thought about, which has not been solidified yet, but is having a kind of and or. So either the bottom 2.5 percentile or all buildings that fall into the red, whichever happens to be higher for that year. So we do want to make sure that the red buildings all do get audited at the time that the threshold's calculated.
I'm going to suggest that the absolute threshold is preferable here, like just from my perspective, because that becomes a risk-based assessment as opposed to a relative one. And if you are living in a red-carded building that isn't going to be part of that audit process, that's a problem.
Yeah.
Right? So maybe it's hybrid, I don't know, but I think there should be at least that threshold of all red actually going through that audit process. At the same time, the scoring on yellow is pretty large. And so if we're also potentially looking at the bottom 2.5%, if somehow we do have a hybrid model that may occur here, there's going to be a glut of buildings that may have some serious issues that aren't actually going to go through an audit process, which concerns me. You know, in your own chart with the new rubric that you're suggesting, it says, I think 21% of buildings would fall into the yellow category. That's fairly substantial if we're looking at 3,600 buildings overall. So again, I worry that there's going to be a lot of buildings that are in the yellow, so to speak, that don't actually have any real recourse for the tenants who are living there. So again, I would recommend that any kind of enforcement be risk-based as opposed to relative entirely. So just that's one thing. So to clarify, there's also a 4-month gap between evaluations and audits. And what I'm curious about, if a landlord can actually request a reevaluation during the period between the evaluation and the audit.
Yes. Yeah, they're able to request a reevaluation between the evaluation and the audit. Right now, it's a 15-day period, so they have 15 days after the evaluation to request a reevaluation. But we are thinking about opening this up potentially year-round to allow building owners to make improvements and request that throughout the year, so they don't happen to be stuck with a red sign if they make improvements for 2 years. We want to have that flexibility be open. But right now, it's the 15-day period.
Okay. I also have concerns about that because it does allow landlords to put in very temporary fixes, which is something that we see, I'm a renter, that we see a lot in our kinds of housing, is that we have solutions that aren't permanent. that will actually address the issues long term. And I worry that they may put in cosmetic or less permanent kinds of solutions in the interim to actually get through that evaluation period and not be audited. Also another thing. I also have some concerns about the reactive scoring. So on the point that I just made, there are often chronic issues in rental housing that are repeatedly fixed in a very temporary way, but don't actually have permanent solutions put in by the landlord because of costs, because of greed, quite frankly. So I worry again that with this reactive scoring, it may not capture the full breadth of how healthy or unhealthy our housing actually is. If there are persistent problems of non-compliance by the landlord, negligence, recidivism, this doesn't actually impact their score permanently. So you could have landlords that do have these lengthy histories of, again, engaging in these temporary fixes, maybe not actually addressing emergency orders or notices in a timely fashion, but that is not reflected in the permanent score of the building. There should be a balance here between landlords who have ongoing bad histories that are known with, well, I'm not on the side of landlords here, quite frankly. I'm just going to say that we should actually be looking at this, I think, in a more thorough way. I'd like to see that under this rubric, there might actually be permanent scoring issues that are attached to when landlords, again, are engaged in this non-compliance or recidivism. Up the street from me, I live in South Parkdale. There's a couple of buildings that are called the Maddox by Fitzrovia, which is just a fantastic name. It's really absurd. But these buildings have undergone substantial renovations in the public areas. But what I know from talking to tenants there is that the units aren't reflecting the state of good repair that they're seeing otherwise in the common spaces, which again, they're often receiving AGIs for this kind of upgrading. When we know that there is that kind of disconnect and when the evaluation is built strictly on communal spaces, it's not necessarily going to reflect the depth and breadth of how healthy, again, people's actual housing is inside their units. So I'm wondering again, is there a way that we can reflect state of good repair within both? And I know that becomes really complex. I'm like very aware of that. But, you know, some ideas that I was thinking about were having, incorporating evaluation, into the evaluation, tenant surveys as a potential way to maybe reflect that, and that could be reflected into the scores as well. You don't like that. Or if there is a high volume of complaints from tenants, for example, that are recorded, can that also be put into the evaluation? Again, these aren't necessarily the best ideas, they're just things that I'm thinking about. Yeah, I think that's everything that I had. Yeah. I'll leave it there. That was a lot.
That's a lot, but it's really good. I'm going to give you a chance to respond to some of those, please.
Yeah, sure. Thank you. That's really good feedback, and I think some things that we've heard through our consultations as well. I will say that for the in-unit issues specifically, that's kind of the purpose that we're hoping to achieve through increasing the reactive scoring, is that tenants can submit service requests, and if a violation is confirmed in their unit, that will actually deduct from the score. So by increasing these percentages, we're hoping that better reflects the building score. But the caveat being that there have to be complaints sent to actually get that information to deduct the score. So it's a bit of a challenge there, but all your other considerations and feedback, we'll definitely take it back. So thank you.
Yeah, and I will just add just on a previous comment about concerns about maybe like a lack of action in the yellow building. So we do have that like target engagement threshold that if there are, let's say, persistent issues in units in a building, and we confirm those violations and they're not being responded to, we do have that threshold that we will go do target engagement, we will do door knocking, we will issue additional orders if there's not compliance for those issues. So of course we'll be auditing red buildings, potentially auditing some yellow buildings, but if they are dropping significantly, suddenly, within a few weeks, if there's a bunch of different in-unit issues, we will have a trigger and be able to respond to that. But yeah, we definitely noted all your concerns. I think it can be difficult for us. This is really a program of continuous improvement. Like introduced in 2017, we made a bunch of changes to the evaluation tool in 2023. So this feedback will really help us iteratively make changes and make sure that the scores are as accurate as possible. So I appreciate the feedback.
And if I can just add to that, sorry, district manager, acting district manager, RentSafeTO. A few things here. So Absolutely. We definitely have heard this feedback through some of the other consultations, but one of the things that we do want to stress that the score does change every 2 years because we're always going to be at minimum in these buildings every 2 years for evaluations. But that's not enough, and we've heard that feedback. So that's why we've been incorporating the reactive data into the scoring system, because it's not just the proactive common area evaluation, it's taking those service requests, about those in-unit issues that you're hearing about, that we want to hear more about, because those reflect non-compliance that we are finding. So if you are getting a lot of service requests and we're finding that there are violations, again, that's going to impact their score. And of course, we are a minimum standards bylaw. We always want to work toward compliance and give that building the opportunity to make those changes. And so again, it's kind of a balance there, but we'll definitely take all that feedback back with us and note that as we kind of progress toward this report in future states. So thank you so much.
Gord. Oh, sorry, did you have a follow-on comment?
We can go back and forth for a while, the two of us. We talk about this stuff a lot. There's sort of a category that doesn't get mentioned. Both the fire chief and the chief building official have the authority when there's a life safety issue to close a building, right? Is that, yes?
Correct.
Yeah. So a thought that occurs to me is, why don't you call those ones red? It's a thought. Take it as you will. And just, I think I have some history on these issues. I think it's important for members of the committee to know this. Municipal licensing and standards staff wrote several reports on this to council, and you recommended against color coding. You're only doing it because council didn't take that advice and told you to go do it anyway. Is that correct?
That's correct, yes.
Okay. One of the issues that many tenants have raised with me is the issue of stigma. That, living in a building with a big red sign on it and having guests or family or whatever could be a real problem. In the design of the signs and the placement of the signs, are you giving thought to that?
The bylaw amendments that are in the apartment buildings bylaw now say that it has to be placed near the entrance of each building in a conspicuous location. So that is the kind of what we're
The
working.
limit that council put on you, I see.
I will add that I think in some of the consultations that we've been doing, particularly with tenants, I think there's differing feedback about whether it's stigma about living in a red building, or it does put pressure on landlords to take action if there's a red sign. So we are trying to balance that.
On that point, correct me if I'm wrong, the fact of putting up a color-coded sign does not give the City of Toronto, the chief building official, or the fire chief any additional enforcement authority at all.
That's correct.
So it doesn't accomplish anything in terms of getting the city more power. It just puts a sign up.
Correct.
Yeah.
Okay. Switching topics, on the remedial action work, again, this is very fraught. It is still, even if we pass, give you more resources for remedial action, a property owner still can deny entry to City of Toronto staff or any contractor we bring. Is that correct?
That is correct. Yes.
Okay. And just so that people have a bit of a grounding about why the remedial action doesn't happen faster, if municipal licensing and standards issues notice of violation against a landlord, they have the right to take that to an appeal committee. Nothing we do changes that. That's provincial law.
That's correct. Yeah, the Property Standards Appeal Committee, yes.
And then even if the property standards folks don't give them an extension or something, they can still go to court and oppose it, correct?
That's correct.
Okay. And nothing about doing remedial action changes any of that. Okay. In fact, it's conceivable someone uses all those tools, slows it down. They've been a building like Diana was describing, maybe they're on Dawes Avenue. And we win the right, we win the right that they have to do something. The courts have said they have to do something. That still doesn't give us permission to go onto their property without their approval, does it?
That's correct.
We would have to go back to court again and say, we wanted to do these repairs and they're denying us entry. And we would need a judge to say, okay, the right of someone to say the public service can't come onto their property, we're going to waive that here. And as far as I know, the only times the courts have ever waived that is like the police in hot pursuit or the fire chief or the chief building official saying there's an imminent life safety risk. Is that correct?
Yeah, that's my understanding, yes.
Okay.
Yeah.
Thank you, Gord. Thank you, Diana. Beat, is that your hand that went up? Over to you.
I just wonder, is this RentSafeTO also applied to house that rented out to people? Because now without cop, most of the I mean people on social assistance or low income people, the places that we were looking for is no longer high-rise building because we can afford the high rent there. So most of the time, I think we're looking for housing. Like rooming house, or even if it's not rooming house, at least unit in a house, got it in the basement, and they are more cheaper than unit in the high-rise building. So I just wonder, would this when RentSafeTO apply to those kind of housing, not building but the house?
It would not apply. Sorry.
Because before I became homeless, the place that I live, never care about the tenant. They didn't give us enough heat, and then when the pipe of the backyard, when the landlady water the vegetable at the backyard, and then the water pipe broke, and then the water went all the way to my neighbor's unit window because they didn't close the window when they go out, and then it seeped because my unit's more lower, so it seeped to my room, and my room was very further, and then lady denied that my room is have a problem. It's only the other room, and then it didn't get treated and didn't get dried up completely, and it stopped molding, and it started infested mosquito. So you would not complain. The landlord cares. So that's why I think it's important also to include that RentSafeTO regulation in those house that rent out to people, especially people on social assistance and low income. Thank you so much.
Thank you. Yeah, I appreciate the comments. I will note that, of course, there is like a specific scope for the RentSafeTO program of, multi-unit residential buildings that meet the definition. But the RentSafeTO program responds to property standards and maintenance issues. Those bylaws apply to properties across Toronto. So if it's a property standards issue in a multi-tenant house or another kind of building type, MLS has various other teams, enforcement teams that would respond to a request that comes through 311. Regardless of the building type, I would just encourage folks, if they are having issues that their landlord's not responding to submit a 311 request. And depending on the building, MLS officer will respond and investigate appropriately.
Thank you. I think that's really important because some of the most vulnerably housed people in Toronto will not actually be in the buildings covered by this. Are there other questions from the committee at this point? Yes, Joy.
I just wanted to follow up on the question that Councillor Perks raised. And have color-coded signs been used in other jurisdictions? And if so, what has been the impact on tenants who, fear their building is unsafe or crappy, but also the impact on landlords who decide, this is a straw that broke the camel's back. My business is marginal. I'm getting out, and we lose affordable housing.
Yeah. Yeah, thank you for the question. To our knowledge, there hasn't been any other municipal jurisdiction that has implemented a color coding signage program like this. I will note that I think a few years ago, I think a third party did like letter grading for apartment buildings in New York City, but I don't believe that is available on the outside of buildings any longer. So I think point well taken that we have to monitor some of the impacts on this, and particularly tenant perspectives on signage. So when this program is introduced in mid-June, we will be making sure we're getting feedback about how we can improve implementation and monitoring some of those outcomes.
Yeah.
Are there other comments or questions at this point? I just want to sort of double agree with what everyone has said, actually, but also just Joy's last point in terms of it has a real impact to the question of stigma, the question of how people react to it. It's also in the notes that, in fact, people are confused by red, and red signals we're hardwired to see red as a no-go. And so, I think to Gord's point, maybe that just becomes where we're expecting a shutdown by the powers that be, because we're kind of hardwired to see that in our culture. So might be something worth reconsidering in other ways of communicating the state of the building. Thank you very much for this presentation. I hope the feedback was helpful. I hope that you take it under consideration because I think that it's important, and appreciate you taking the time today. Thank you.
Thanks so much.
With that, I would move to receive the item, and all in favor, can I see your screens, see your hands? Very good, thank you very much. And that brings us to the next item, which is the midpoint assessment of the HousingTO 2020-2030 Action Plan. Meredith Kratzman, Manager, and Sarah Carosi, both Senior Strategic Policy Consultant with the Housing Secretariat, are here to provide a presentation on the midpoint assessment of the HousingTO 2020-2030 Action Plan. Over to you both.
Thank you very much. Through the chair, and thank you for having us today. We're happy to be here to share with you and get some input on our plans for an independent assessment of the city's progress in advancing the progressive realization of the right to adequate housing through the HousingTO Action Plan. So I think you all know me, or I know all of you, in working with the Housing Rights Advisory Committee for the past couple of years, but just in case, I'm Meredith Kratzman and recently stepped into the role as manager with our Housing Systems and Intelligence team at the Housing Secretariat. And I'm joined today by my colleague, Sarah Carosi, who's a Senior Strategic Policy Consultant on the team. So just a quick overview. This will be a fairly quick presentation, but we'll provide some background on the assessment and why we're doing it. Then we'll share the proposed approach, including the key objectives, deliverables, and outcomes for the assessment, as well as the project timeline and next steps. And then we'll really open it up for discussion because we hope to hear from you as we proceed to finalize our approach for this work. So this is a repeat for sure, but as you all know, in 2019, City Council adopted the HousingTO Action Plan, which includes the Toronto Housing Charter and really establishes the city's commitment to advancing the progressive realization of the right to adequate housing using a human rights-based approach. Following the adoption of the HousingTO Action Plan, one of the actions was to complete a review to assess the establishment of the role or function for a housing commissioner, which was completed by Fiona Crean, the former Toronto Ombudsman, and the Maytree Foundation. And as a result of this review, City Council received a report from staff and adopted a suite of recommendations in support of its commitments set out in the Toronto Charter. So those recommendations have led to, of course, things like the establishment of this committee, the establishment of the housing unit within the Ombudsman's office, and the appointment of the Deputy Ombudsman Housing. And the report also included council direction for staff to complete an independent assessment of the city's progress in advancing the right to adequate housing, which is also integrated into the mandate of this committee to support and advise council on this process. So throughout 2025, staff in the Housing Secretariat have been meeting with subject matter experts to inform the development of a preliminary scope of work for the assessment, including the chair of this committee, the Deputy Ombudsman Housing, and other key subject matter experts in the field. And so really our objective in coming here today is to receive some final feedback on our proposed approach for the assessment, to support the refinement of our scope of work, and to proceed with seeking independent consultancy services to complete the assessment. And so just some further context, we see this really as an important opportunity to assess how well the city's policies, programs, bylaws, decision-making, some of the things we've even heard about here today, apply a human rights-based approach so that we can ultimately impact on housing adequacy for people, particularly I think people most impacted, so those experiencing homelessness or housing precarity. And, I think it's a refresher for this committee, but, a human rights-based approach is really a framework to align policy and program development processes with human rights standards and obligations. And it really underscores the importance of the process in addition to outcomes when assessing how well the city is doing in terms of progressively realizing the right to adequate housing. So in practice, a rights-based approach can be broken down into these panel principles, which you see here, as an approach to assess our progress. It may also mean looking at things like the allocation of maximum available resources within the city's means and jurisdictions to create and maintain affordable housing or support those or support those most impacted by the current state. And also, how well is the city coordinating and collaborating across city divisions and other orders of government to identify responsibilities and obligations in fulfilling the right to adequate housing. And yeah, so I'll pass it to Sarah now to kind of get into the details of the approach we're proposing.
Thank you so much, Meredith, and thank you to everyone here and the opportunity to connect with all of you. In terms of the evaluation that we're speaking to here, one of the core deliverables is the development of a bespoke housing rights evaluation framework. Through the engagement we did in 2025, we heard about the importance of taking into context the municipality and what can be done at this level and the importance of disaggregation with other levels of government. We spoke earlier, Meredith, about the panel principles. We've looked at other evaluation frameworks, and really we're looking to create our own that is specific to the Toronto context and measuring not the targets or the commitments that we've made under HousingTO 2020-2030, but rather our commitments as a firm through Toronto's housing charter and the advancement and progressive realization of the right to adequate housing. In terms of applying this framework and really where there's rich opportunities for learning is through a process evaluation, looking at how well the city has done, both in terms of the development, but also the implementation of our housing-related programs, policies, services, and their alignment with these commitments in terms of a human rights-based approach. What will come out of this are opportunities to inform the work that we're doing right here in this moment. We have an additional 5 years to bring us to 2030 in terms of our commitments under HousingTO, so we can look at informing and making changes to our programs, to our policies, and our services, as I mentioned, through our development of new items coming forward, but also the delivery of those that are already in place. Earlier today, we heard presentations focusing on supportive housing and the importance of data collection and monitoring and how that can inform. We'd like to take the learnings from this assessment and apply them now, implement potentially new ways of monitoring and understanding how we are doing in terms of advancing this progressive realization of the right to adequate housing. And in the longer term, we have the opportunity to inform our next iteration of the HousingTO plan, which will come at us very rapidly, and we're aware will be for 2030 and going forward. And more important, and ultimately, is really advancing this progressive realization of the right to adequate housing, which is why we are all here. We wanted to share with you where we're at in our timelines, as well as what you can expect in terms of the delivery of these items. Here today, we've already begun our work on setting the scope of work, as Meredith had mentioned, speaking with subject matter experts, and we're looking to procure consultancy services so that we have this independent assessment. Today, we're looking for feedback from all of you that will help to make refinements and finalize this scope of work that we'll be putting forward. We will move into, in Q2, commencing this actual assessment. As I mentioned, development of the evaluation framework and moving forward in beginning our data collection itself. We'd also like to put forward the opportunity to connect in with this committee here, should you be interested, and we would love to hear from you in terms of where we're at and where we're planning to go. In Q3, moving into the fall, we'll move into the actual data analysis and the drafting of the reporting and those key recommendations and findings that will come out of that. The final report itself, inclusive of those recommendations, would be coming forward for end of year, and we'll integrate our reporting into our annual HousingTO 2020-2030 action plans. And I'm delighted to open the floor now. We have a few discussion items that we've proposed here, but welcome your thoughts. We were speaking earlier about policies, programs, services, which are absolutely very broad, wide encompassing. We recognize within the HousingTO annual reports that we've recrafted this and structured in the last 2 years. You'll see within that we talk about the creation of new affordable housing, preserving what we do have and maintaining that affordable housing stock, supporting people who are experiencing housing precarity and homelessness. However, we'd like to hear from all of you in terms of any key areas that you would like us to focus on and ensure are integral to the work that we're doing. And secondly, as I mentioned, looking at the municipal context, are there any particular key housing right indicators that you would like to bring to our attention and or would like to see centered within this work? Thank you so much.
Thank you, Sarah. Thank you, Meredith. Opening to the floor, starting with Gord.
Thanks. And thank you for this work, and I'm glad to see the progress you're making on it. One of the things that I think a lot of us on the committee have become aware of as we try to do this work is while, and we saw this in the last issue, property rights are really well defined. In the Toronto context and even in the Canadian context, the notion of the right to housing isn't something that's been explored in detail. There's, not a lot of case law, there's not a lot of practical experience. And I was wondering if in your evaluation, a piece that might be useful is to say, well, here's evidence of the city or HRAC or the ombudsman, deputy ombudsman actually starting to define what that means and to struggle with some of the complex questions that are new in our context, rather than just saying, is it pass fail? Are you meeting the progressive realization? Saying, no, part of the value here is defining it. I was wondering if that's one of the things you're going to charge the consultant with doing.
Thank you for those points. I think in part the piece around like the importance of process and looking at how we're doing this is where we're trying to get at what you're speaking to, I think. So, the longer term kind of outcomes we might see in terms of actually long-term impacting on housing adequacy for Toronto residents, it will be hard to really measure that, right? But are we taking the steps we need? Are we going about it the way that I think, using a human rights-based approach would demonstrate to ideally achieve those longer-term impacts on housing adequacy. So yes, I think to your question, I think that is what we're hoping to achieve with this.
I just want to echo that question, but also the direction that this goes in, because I think that when the question is as broad as it is, you could spend $5 million trying to figure out an evaluation for this and still not know the answer. And so to how you began describing this, Meredith, is that I think the City of Toronto is out in front as a municipality in recognizing the right to housing in the Charter and moving forward with implementation with those sort of the foundation pieces of the architecture for this, one of them being this council, this committee, the other being the role at the ombuds. And there have been some practical experiences of looking at what does a human rights-based approach look like here. And we've seen it with encampments. We've seen it in with multi-tenant housing, where there's been deep thought about how do you apply this and how does it become practical, that we can point to it and see what difference it makes. And I think one of the missing tools in this has been a compliance tool. Are there tools that we can actually bring to and share with staff, policymakers, directors to say, this is how you actually bring this set of values or principles, like the panel principles, the elements of the right to housing, affordability, safety, security, habitability, all of those elements. How does that sit with that? And then how do we bring that together to ensure that we're moving forward? It's not we're there or not there in terms of progressive, we're progressing and we have markers. We've got data, we're monitoring, we know that we're getting there. And so that, and also the maximum available resources. Are we doing everything we can? Are we freeing up city lands for innovative things that may put people in homes? Are we doing all the right things and figuring out what are those resources we can allocate to that so that we can say at the end of the day, we did make progress in X, Y, and Z place? I think it's a challenging task, but I think depending on the scope, and I use scope both in terms of the breadth across the city, the many multitude of programs and files that can actually come under this, and then the reality of how many people, how many months, and what can we actually get done. I think seeing how we have seeded this in a very nascent stage of realizing the right to housing in the city, are we on the right track? Have we got the right foundation pieces in place? And how do we support them to do better? And I think that this committee itself should also look at evaluating ourselves and saying, what do we, if this committee is struck by the next council, where is its starting place? It'll be a different starting place, and we can begin to think about doing different things. And I will invite my committee members to think alongside with me. Maybe we spend our last meeting together thinking through how we evaluate how well we have done and what advice we give going forward to the next iteration of this committee. So that's right. So I would just say on behalf of the committee, and I don't have all of them saying that they agree that I'm saying this, but I would like to see this consultant work closely with us, because I think we have lots of learning under our belt. Some things have gone well, some things have been hard. And that's the reality of starting something new that hasn't been done elsewhere, not a lot of other jurisdictions. On the question of property rights, I'm just going to take this opportunity to say this, that the German constitutional courts have recently said that property rights do not trump the right to housing in terms of putting in ceilings on rents in pressured areas. So we just have to get the courts working, and there are cases that are moving slowly through. We have legal work that is happening, so let's see what happens. I will stop talking now and give space for anyone else on the committee. Lindsay.
I just had two quick comments. Well, there might not be case law here Finland's Housing First initiative can really speak on the benefits and can also be kind of a benchmark for the consultants because they're already ahead of this and they've seen a lot of benefits. So I think that's a good point to raise. And then also the human right audit for the city's budget, I think could be also important going forward in monitoring. That's all.
Thank you, Lindsay. Anyone else want to comment or ask a question? Can you say that into the mic?
I'm really proud of all this work that we've been doing on this. I really am.
So do I. I am as well, and I think we have a long way to go, but it's a really good start, and it's because of all of the people that have been around this committee. So an opportunity to say thank you, but also to the Secretariat who has been helping us. So thank you for this. Excited to see the evaluation go forward. And let's get that RFP out and get this person started. Thank you.
Thank you very much.
Okay. I will therefore move to receive the item. All in favor? Excellent. Carried. So that brings us to the last two items on our agenda, which are reports from our working group chairs. 9.5 is supporting unhoused rights supporting unhoused rights holders working group. Maybe the first evaluation will be on the ease of the titles of our working groups. Over to you, Diana.
I actually can't remember them half the time. I'll keep this brief for everybody. So at our last working group meeting, which was on January 14th, we provided some updates in regard to questions that we had around the interdivisional protocol on encampments. As we understand it, this is not coming to this meeting, obviously, because it's not on the agenda, but we submitted further questions in regard to the protocol that we're hoping some answers for, not just for our working group, but for the committee more broadly. We also had a consultation with city staff around mapping pathways from homelessness to housing and a particular tool that they're developing. So you'll recall that this committee, myself, wrote to ECDC, so the Economic and Community Development Committee, asking rather, that we actually incorporate into this kind of citywide approach that ECDC is looking at, an evaluation or a tool, a way of mapping out all the resources that are available to people in order to actually access housing. So a tool was shown to us, and we had lots of different pieces of feedback. And I think as a frontline worker, a lot of my feedback was that it's very accurate, but I'm also someone with deep knowledge of how the system works, which is to say not necessarily the target audience for this tool. So we heard from folks with lived experience about whether or not this was actually something that was usable for people who did not have familiarity with how the system works at all. And that would actually include new workers as well, not simply people who are experiencing homelessness, but people who are relatively new to working in the sector. General notes is that we felt that the tool was clearly organized, accurate, well summarized, but again, not necessarily something that's accessible to certain segments of the population. And so we suggested maybe some corollary items to be kind of incorporated into the rollout of this tool, including training for drop-in workers and frontline staff. A lot of people don't, again, know exactly what those pathways into housing actually are. So in rolling out this tool, it would be helpful for frontline workers to also be engaged in how this system actually works so that it's usable for them as well as for people who are experiencing homelessness. We also noticed that there weren't incorporated into this tool any pathways for survivors of gender-based violence. So that was an important piece that should be incorporated into this tool, is that we also look at those particular pathways, even though we also know that a lot of those pathways happen to be provincial in nature. Again, accessibility and transparency, is this something that's usable for people? Broadly speaking, we felt that it did need refinement and clarity in order for it to be useful for the intended audience. And then we kind of got into the weeds about some of the documentation That's required. That is mentioned within this tool. So what do you actually need to go through this pathway into particular forms of housing? We talked about the difficulty of accessing ID, that going to paid clinics, so Partners for Access and Identification, isn't always timely for folks. It may not always be the most accessible, so obtaining photo ID and hanging on to it is a major challenge for people who are homeless. As well, we got into the weeds about taxes. Who likes those? Nobody. But it is.
I'm proud to pay taxes.
I'm proud to pay them, I just don't like doing them. I don't think anybody does. So in this case, it is extremely onerous for people who are homeless to often go through filing their taxes. And having done this myself voluntarily for a lot of people, we often have to file 10 years of taxes before someone can even be eligible for housing. So this is, again, quite onerous. And while it's kind of indicated on the tool as something that you need to do, we also have to recognize that there are a lot of barriers for people accessing services to support them to actually file their taxes. Again, the majority of this is done voluntarily by frontline workers because there are very few services set up to actually support people to do this. We also believe that this tool should be periodically updated in consultation with people who are currently experiencing homelessness and who will actually be utilizing this tool. And we recommend that the tool actually be tested with the Toronto Unhoused and Homeless Union, or TUHU. I think that's mostly it. We also did a bit of planning. So again, I mentioned that we were looking at the interdivisional protocol and encampments and the city's enhanced outreach model. There is a bit of a gap between how we understand people are exiting encampments and where they're actually ending up. So again, we proposed additional questions to better understand where it is that people are ending up, because it's simply not good enough to say that an encampment is resolved. We need to monitor the human rights outcomes of where people are going, what's happening to them. Are they ending up in housing? Are they ending up dead? These are real questions that I think need to be answered before we can adequately evaluate how we're doing on our approach to encampments. So next steps include asking the Housing Secretary to provide an overview of the pipeline for city-supported and supportive housing developments, key barriers including zoning, permitting, approvals, blah, blah, blah. I'm not going to go through the full list of these. Again, we had a presentation on supportive housing, but we are also looking to, again, further review this as it moves forward. And, ooh, this is my item. I would love to know where we are on the Service User Advisory Group, or SUAG. This really should be a priority, I think, for our group, and I think the group broadly agrees that we need to look at how are we incorporating the voice of people who actually use services into our ongoing evaluation and development of programs. So hoping for a presentation on this, and hoping again that once we actually have a better understanding of what this SUAG group looks like, can we also involve TUHU, or the Toronto Unhoused and Homeless Union, in evaluating the outcomes of this group. And that is my update.
Good update.
That's a great update. Thank you, Diana. Are there questions or comments or anything else to add to that? And I'm looking, I want to just also acknowledge Diana chairs this working group, but it's a working group that really works, as you can hear from this report. And thanks to Lindsay and Bea, I also get to come to these meetings, and so it's really a wonderful report and good work happening. So thank you to all of you. Are there any questions or add-ons for Diana's report? All right, there it is. You covered it. So I will move to receive the item. All in favor? Thank you. And carried. So the final item then is improving access to housing working group. And that is over to you, Anne-Marie.
Can you guys hear me?
Yes.
Good afternoon. Good afternoon, everyone. So improving access to housing working group, we've met on January 19th. And our mostly our points of discussions were around the cooperative housing. There's some discussions that came up around eligibility barriers. Currently, the eligibility requirements for cooperative housing may unintentionally exclude survivors for gender-based violence. We noted that. Also, we had some concerns around individuals receiving Ontario Works and individuals receiving Ontario Disability, individuals on ODSP. These barriers, as noted, we believe limit access for populations with urgent housing needs. And so, therefore, we continue these conversations because these things are important to us. And it is our hope to invite someone from the Cooperative Housing Federation, or hopefully at one of this HRAP meeting, maybe before or by April, just to come and provide a presentation on our next household access to cooperative housing and how supply can be increased to address the growing demand for safe, affordable, and adequate housing. So hopefully we can get a date sorted out for our next HRAC meeting. Also, to continue on, we had an overview from the consultation from the Housing Secretariat staff, from the Access to Housing team on the Affordable Rental Program integration. And just an overview from that, the Housing Secretariat staff from the Access to Housing team had requested a consultation with us as a working group on some key policy considerations around the integration of affordable rental program onto the city's centralized waitlist for rent geared to income, which I believe is my Access Housing Toronto. We met and we discussed some key policy issues around the integration of affordable rental housing, and staff overviewed and highlighted the key policy considerations, which included two key policies: the allocation methodology to tenant affordable housing units, which include whether to incorporate a mix of random draw and the chronological units to implement a 100% random draw. The other point was how housing providers may be able to request targeting the allocation of affordable housing units to certain priority groups or communities. And we had a lively discussion around RGI housing versus affordable housing, noting mostly that there needs to be a clear distinction between RGI in Toronto community housing and also RGI in new affordable housing developments. It is also important that applicants understand the eligibility and allocation processes for both. We also noted concerns about frontline knowledge gaps, particularly as it relates to shelter counselors who often do not understand the difference between RGI and affordable rental housing, and of which clear, simple education materials are needed for staff and applicants. Noting also that RGI, rent geared to income, and affordable housing serve different populations with different needs. And I think that's key to note, and that RGI rent fluctuates both on income while affordable rent does not. And some things around advocacy needs, since affordable rental housing targets moderate to middle income households. That's the reason why we believe as a working group that we should continue advocacy around this, because it is needed for it's needed for more provincial operating funding to expand RGI units for lower income households. And around location and adequacy of new RGI unit. As a working group, we believe it is important for us to understand where new RGI units will be located. This is important in ensuring housing adequacy, access to services, and community stability. Council also has directed that some affordable units be set aside as RGI, but if new RGI creation depends on provincial or city funding, this might create confusion for some applicants. Therefore, people on RGI waitlist may not know whether they can access RGI in new affordable buildings. So there's a need for clear distinctions, and it is important to distinguish between RGI in Toronto community housing and RGI in affordable housing developments. And as I mentioned before, applicants must understand how these processes work. Also, what came up for us, we talk a bit about the random draw approach. And as it relates to, in terms of allocation of affordable rental housing units, some core consideration points of discussions were around fairness and transparency. Staff must ensure that eligible households in genuine need can access affordable housing fairly and transparently. And as for context, the demand for affordable rental housing far exceeds the number of units becoming available in the next several years, noting that traditional waitlists can leave applicants waiting decades without meaningful access. As for the random draw approach, we understand that a 100% random draw system may prevent decades-long wait times, ensure all eligible applicants have an active, equitable chance of selection, and reduce administrative burdens associated with long wait lists. But there are some risks of specialized access requests, which we need to note here. Allowing housing providers to prioritize certain groups may also introduce bias in the tenant selection or discrimination, intentional or unintentional. And if priority groups are not equity deserving, and we're talking about religious groups, language-based groups, artists, and all that, this may undermine equitable access and exclude applicants with greater housing need. And some equity considerations about priority and process to be considered or priority access should be limited to recognize equity deserving populations, and processes must align with human rights principles and anti-discrimination policies. Some next steps from the presentation discussed, staff noted opportunities for the public to submit written communications or dispute when the item proceeds to the Planning and Housing Committee. And last but not least, concerning our working group next steps, our members shared interest in potentially submitting communications or deputing to council to ensure that council's commitments to allocate a certain portion of affordable units as RGI units is fulfilled. An invite will be sent to the Cooperative Housing Federation to provide, like I said, a presentation at our next HRAP meeting to address some of these issues around safety, safe, affordable, and adequate housing. And the last thing to note is that our HRAC chair submitted a letter to the Provincial Minister of Municipal Affairs and Housing just to express the committee's deep concern regarding the funding cuts to the Canada Ontario Housing Benefit for this year. That's all we have for our working group. Thank you for listening.
Excellent report. Thank you, Anne Marie. Again, the members of that committee include Lindsay and Bea and Chase, and so thank you so much for your work and really important issues you've raised around equity and access to RGI, affordable spaces, and so forth. So thank you. Are there questions from members of the committee or comments? Bea, is that your hand? Go ahead.
I I just want to add after the consultation of the staff came to us, we stress about clarification of new affordable rental home program, and then the RGI, the 20% that the council suggests, is more. I mean, the new affordable rental home, it's a random draw by lottery system, but the other one, RGI, is 20% up. The RGI is not random draw, but by priority. And recently, maybe a few weeks ago, I received the new affordable rental home program, the new unit they put out, and they did very clearly to clarify. They did very clearly and specific that those units for the affordable housing is lottery system, by lottery system, a random draw. So they put on the headline. So when I look at it, I say, wow, they already listen to our suggestion and do it right away and make it very clear that affordable housing is only for, it's not RGI, it's random draw lottery system. So that's good. They did receive and do what we suggest. Thank you.
Thank you, Bea. It's great. Anyone else want to add to this? Then thanks to the working group, and thank you, Anne Marie, for an excellent report. And I will move to receive the report, and all in favor? Thank you very much. That's great. And that brings us to the end of the meeting. And so could I have someone, we're going to put the motion up on the screen to excuse absentees. I will read that the Housing Rights Advisory Committee excuse the absences of Annie Hodgins, Maria Saroja Ponambalam, and Harmi Aleve Javier Mendoza from the February 20th, 2026 meeting of the Housing Rights Advisory Committee. I will move this. All in favor? That's wonderful, and that brings us to the conclusion of this meeting. I do want to say again, thank you to this committee. I think we are doing good work. You're working hard, and I think we're beginning to see the results. I want to thank our support team from the Housing Secretariat. They make all of our meetings happen. They keep us on track. They bring us stuff and tell us what we need to be worried about. And a special thanks, I've heard tell that apparently the tech team did an exceptional job. The YouTube feed is excellent. There we go. So thank you, everybody. Oh, sorry, and the city clerks. Oh my God, to my right. Thank you so much for making all of this happen and your patience as I continue to learn how to make this system operate properly. Thank you.
Thank you.
Thank you.